Good morning and welcome to United Way for Southeastern Michigan's virtual town hall. My name is Audrey Walker and I will be your moderator for today's town hall. Today we will hear from United Way's President and CEO, Dr. Darian Hudson, and then Michelle Driscoll with the Michigan Alliance for Families will provide information and resources for parents and students with disabilities. The last 10 minutes of today's town hall are reserved for questions. Please leave your questions in the Q&A box if you're watching on Zoom or in the comment box on Facebook. Now I'd like to give a warm welcome to United Way's President and CEO, Dr. Darian Hudson, to say a few words.
Thank you, Audrey, and good morning, everyone, and welcome to our weekly town hall, where we've been trying to bring up-to-the-date information for you and your families as we're navigating through these unprecedented times. This is typically my favorite time of year. I used to be a teacher, I used to be a superintendent, and there's nothing like the buzz of opening day for schools. But unfortunately, we know this year is a lot different, and we have to be much more creative and innovative in the way that we are providing services and resources to our young people, as many of our school communities are experiencing hybrid models, face-to-face learning, as well as at-home learning for most of our children. And so thinking outside of the box is an understatement, but also how do we manage this? And where are the tools that are available to us to be able to provide these resources to our children during this time? We also understand that for students with disabilities and for families who are nurturing students with disabilities, this can be more complex, and that there are new procedures that we must follow, and that we have to make sure that our virtual learning options are also accessible for all of our children, because that's what they deserve. Today, we are so grateful to have Michelle Driscoll with us. She's the policy coordinator for the Michigan Alliance for Families, and she's going to be sharing pertinent information with us in terms of how we can support our young people with disabilities. For the past 35 years, Michelle has been a strong advocate for the dignity, the rights, and full inclusion of individuals with disabilities in schools and in office settings and in the community. Prior to her current role, Michelle served as the advocacy director for the ARC of Northwest Wayne County for 21 years, providing advocacy and training and special education laws and rules, resources, and services for individuals with disabilities and their families. Michelle has served on the Special Education Advisory Committee, is a member of the ARC Michigan Education Committee, a member of TASH, an international leader in disability advocacy, and is a certified independent person-centered planning facilitator. Michelle is now the policy coordinator for Michigan Alliance for Families, where she serves as a liaison to the Michigan Department of Education and the Office of Special Education to facilitate information gathering and sharing. Michelle collaborates with staff members, statewide organizations, partners, and stakeholders to develop and enhance training materials for parents around laws impacting the education of their children with disabilities. Michelle is truly a friend and advocate to us all, and I'm so pleased to welcome her today to our town hall. This information is very personal to so many of us, and we're eager to hear what you have to share with us, Michelle. So welcome. The floor is now yours, and looking forward to learning from you.
Thank you, and thank you so much to United Way of Southeastern Michigan for inviting me to share information about Michigan Alliance for Families and some things to think about as schools are reopening. Next slide, please. The Individuals with Disabilities Education Act supports the importance of parents being involved in the development of their child's IEP. In order to do this, parents need access to consistent, accurate, and timely information. They support this through parent training and information centers in each state, and Michigan Alliance for Families is the Parent Training and Information Center for Michigan. The Michigan Department of Education also values supporting parents to be involved in their child's education and IEP development, and both support our work through grant funding. Next slide, please. Michigan Alliance for Families supports families and educators with resources and information about disability and special education issues involving children and young adults from birth to age 26. Michigan Alliance for Families assists parents in understanding their special education rights and protections, communicating their children's needs, finding information to help their children develop and learn, and facilitating family involvement to improve educational outcomes. Michigan Alliance for Families has a comprehensive website that includes special education and disability-specific resources, including an e-newsletter, as well as information and resources related to COVID-19. We are offering statewide virtual events and learning opportunities throughout this year. You will find our links to our on-demand webinars and YouTube videos on the website. We have an archive of recorded webinars available for you when you need to access to learn, understand, and manage topics related to special education. We also have several COVID-19 videos addressing special education issues and returning to school considerations. All of our materials and events are free to parents, caregivers, and educators. Some upcoming online learning events in September are strategies for supporting your child's learning at home, positive behavioral interventions and supports, and universal strategies for use in the home and to assist your child's transition back to school, and that is on September 16th. And then starting tomorrow, we have a 4-week Iep course for parents to improve the quality of their contributions to their child's Iep and increase their effectiveness to address concerns using the Iep process. And these events are listed on our website under upcoming events, learning opportunities, along with registration information, or by contacting Michigan Alliance for Families directly. Next slide, please. If you are in need of individual help, Michigan Alliance for Families, it has parent mentors who live throughout Michigan. Parent mentors have a family member with a disability and work in the region which they live. They are available to talk to parents and professionals about special education and related services and disability-specific information. You can find the parent mentor in your area by going to the Michigan Alliance for Families website and looking under the About Us tab. You can also reach them at 800-552-4821, and through the magic of technology, you will be sent directly to the parent mentor in your area. Next slide, please. As the new year begins, parents are thinking about how their children can return to school safely and how their children can progress in school, whether it's in person or virtually. COVID-19 has not changed any rules or regulations regarding a free, appropriate public education, least restrictive environment, IEPs, and procedural safeguards. Districts must figure out how to provide services to children and ensure that a free, appropriate public education, FAPE, is provided. For each student with an IEP, the state encourages IEP teams to create a contingency learning plan to explain the special education and related services the district is able to provide during the pandemic when the full offer of a free, appropriate public education cannot be provided. The contingency learning plan is developed by the IEP team, including the parent, is individualized and based on the current IEP, and make sure the student can access the education being offered by their district. For each student, each student's IEP must be current to the school year and is the basis for discussion regarding the development of a contingency learning plan. Whether this school year starts in person, virtually, or a combination of these, teams, including parents, should engage in collaborative conversations to develop contingency learning plans in order to support a fluid approach to education this year. Some events that may trigger the need for a contingency learning plan are that the district is providing virtual learning only or a combination of virtual and in-person learning, and a parent chooses to keep their child home due to health and safety issues, or a student illness due to COVID-19, or a household member who is quarantined due to exposure to COVID-19. The contingency learning plan and the identified triggers should be referenced in the current offer of a free appropriate public education in the IEP. And parents and schools must work together to figure out how to address the child's needs as the new school year starts. Next slide, please. Whether your child will be returning to school in person or learning virtually, these are some things to consider as school is beginning. The community spread of COVID-19 in your area, people in your household over 65 with underlying health conditions, the face covering policy in the school, the distancing policy in the school, the ability to supervise children at home during the day, social opportunities for your child, and how long the commitment is if you choose virtual learning or in-person learning. It is up to each district to determine how to implement the protocols for social distancing, hand washing, and disinfecting of surfaces guidelines in their schools. Next slide, please. Think about your child's needs and think about your concerns and questions and document them. You may need to ask more than one person to get concerns addressed and your questions answered. Talk about what virtual and in-person learning will look like for your child. For in-person learning, will your child have difficulty wearing a face covering all day? Will your child need assistance with hand washing? Will someone else be using a tissue to wipe your child's nose? Will your child need assistance to understand how far to stand from others? Discuss who will provide help for your child if he or she needs it. If your child needs additional adult support, for example, a paraprofessional or an aide, how will this look in person? How will services such as speech and language therapy, occupational therapy, or social work services be provided? And think about community-based instruction or work experiences for young adults. What will these look like in person? Teach and reinforce hand washing and/or the safe use of hand sanitizer at home, and teach cough and nose blowing etiquette. Next slide, please. Share information with the IEP team about conversations you and your child had during distance learning in the spring. What worked and what didn't work. If your child will be doing some virtual and some in-person learning this school year, discuss what your child needs to succeed in these environments. For virtual learning, will your child need redirection? How will accommodations and modifications be provided? How will your child need to build relationships with an all-new IEP team? How will your child's services be provided? Will some services be provided in person? Review the provision of a free appropriate public education during the period of distance learning. Some specially designed instruction, supplementary aids and supports and related services may not have been provided during the school closure and may have resulted in a regression of skills or affected your child's ability to make progress in the general education curriculum. Discuss data that you have collected regarding your child's progress towards his or her IEP goals and any regression of skills during the school closure and the impact on your child's progress. Do you need to meet with the team to discuss changes? When will the IEP be updated to reflect new needs? These are things to consider. Should also consider implementing a home and school communication log so that information shared between you and school is in one place. And know your rights. Your school must give you written notice, provide you certain information in writing, whenever it proposes to initiate or to change the identification, evaluation, or educational placement of your child, or the provision of a free appropriate public education to your child, or refuses to initiate or to change the identification, evaluation, or educational placement of your child, or the provision of a free appropriate public education to your child. Next slide, please. Be patient with yourself and the school personnel. The situation we are in is new to everyone. Be aware and understand what your district's plans are to help ensure that students are following practices to reduce the spread of COVID-19. Ask how you will be notified if someone tests positive in the school or in your child's classroom. Know the procedure and how the school will handle this. Develop a plan with the IEP team that addresses concerns you may have for your child regarding his or her learning, physical, mental, and emotional health. Discuss the plan and get input from your child if possible. Keep communication open and ongoing and keep asking questions. There are no wrong questions. Share your concerns openly and in writing. If the teacher doesn't have the answer to your question, ask an administrator. Next slide, please. And remember, Michigan Alliance for Families is here to help you. Check out our website with more information related to COVID-19 and your child's rights and protections when receiving special education services. Thank you.
Thank you so much, Michelle. We really appreciate all this helpful information that you've been able to provide today. And we do have a few questions coming in. So if you have some questions for us, please be sure to put them in the comment box. One of the questions coming through, as you mentioned, this hybrid of online virtual learning and in-person learning is that if my child benefits from in-person learning to grow emotionally, develop friendships, and learn coping skills, if we don't have the option for in-person learning, where can we look for additional support?
I would suggest first going to Michigan Alliance for Families. We have lots of general information as well as disability specific information, and that will offer at least a start. We partner with many organizations and agencies and have information from across the state. So there are a lot of resources there for social questions about social skills and learning and emotional health and mental health, as well as special education specific information. And also I would take a look at our upcoming webinars and learning opportunities throughout this year. We will be offering, of course, all virtual this year. We're not doing any in-person, but a lot of the opportunities that we are providing are bringing educators and professionals and families together to talk through a lot of these issues.
And would that include some of the private therapy and services that are provided often through school, that if school is not available, a lot of families have stopped receiving those services? Is that the same types of information?
Yes, the information about resources and where to get guidance on that and how to address what to do if those services are not being provided, that is on our website. And I would encourage families to talk together with the IEP team for services that are not being provided. Some things can't be provided virtually. Districts must meet the child's needs. So together with families, they should be talking together about if they can't provide those services virtually, is there a possibility that they could provide those services in person? Might not be a full school day in person, but they might be able to set up individual meetings and sessions with students to provide some of those services. But it really is the collaboration of the families and the IEP teams to come together and talk about how they're going to meet that child's needs.
Definitely. And you mentioned, staying organized and having a school and home communication log as well. What other kinds of things should people be keeping in their IEP files? Like what types of documents, and how can they best stay organized?
I would suggest keeping whatever documentation you get from the school. So of course, the IEP and evaluations and informations, but I would also suggest, especially during this time, to document conversations that families are having, if requests for services, if a school is saying that they cannot provide that service, to document that conversation and keep track of that. And just a reminder to families too that all of the procedural safeguards are in place. So if families and schools are not able to resolve disputes or disagreements with schools on what should be provided, that there are different options to kind of bring schools and families together to have more conversations about those to try and make sure that the child's needs are being met.
And I was just going to ask you about what kind of tools are available for resolving any sort of special education issues. Can you expand on that?
Sure. So, of course, starting informally with just having an IEP meeting and having the conversations. If that doesn't seem to work and there's still disagreements, that the IEP team, including the parent, the school and the parent can't agree upon, the Special Education Mediation Services Program, SEMS, it's sometimes called, offers IEP facilitation. They have facilitators to help with IEP meetings to kind of make sure that everybody's voice is heard at the table. They also provide trained mediators who can help, again, bring families and schools together to talk about some of the disagreements. And there is, state complaint process and complaint process to request a due process hearing. But really, families, I think, should start with some of the informal ways to kind of bring people together, just sitting around the table and trying to figure out how to meet that child's needs and resolve some of those areas where they don't agree.
And do those mediation services have any cost to them?
No, those services through Special Education Mediation Services are free.
Okay, great. Yeah, that's very helpful too. And with distance learning, what's the best way to monitor a child's progress? And what should a parent do if they feel like their child is falling too far behind?
So Michigan Alliance for Families, again, under on our resources, and we have a pretty extensive COVID-19 webpage with lots of links to documents, will help give parents some information about how to keep track of their child's progress monitoring, and what to document. And we provided, in the summer, we developed kind of a double-sided one-page handout to give some parents information about how to keep track of the progress. If they don't feel like their child is progressing, then that would be a time to get the IEP team together to talk about that. Lots of learning was lost for all children in the spring, and it's really important now during this time of year to be talking about what skills were lost and the regression, and what services may be needed to kind of get that child back up to where they should be.
Definitely. And you had talked a little bit about the statewide virtual events that are going to be offered throughout the year, including the Iep course that's coming up. Can you expand a little bit on what parents and caregivers can expect from these courses, and a little bit more about what's going to be offered?
Sure. So so again, take a look at the Michigan Alliance for Families website. We are getting our schedule together for this whole coming year with learning opportunities. So we don't have the exact schedule for those, but if you reach out on the website, or if you're not able to, you can call and get information as well. The IEP course that starts tomorrow is a 4-week course, and it's going to go through, so it's a presentation, a short piece of a presentation, about 20-25 minutes of content that will be presented at each of the 4, it's one class for 4 weeks. And then there will be breakout rooms. So parents will get individually, will have the opportunity to talk with a parent mentor and go through the different sections. So it's going to go through the different sections of the IEP and what to look for in each of those sections, what information should be included in those sections. And then following the course for that week, actually before and after, parent mentors will be reaching out to parents who have registered, family members who have registered, who live in their areas, to kind of connect with them and make sure that they're understanding everything that's going on and share any concerns or ask questions. So it's not just somebody presenting content and then that's the end of it. There's going to be very great conversations, great conversations with families and peer mentors, and will help families to learn about the IEP and the IEP process and how to go through that, navigate through that for their child.
That's great. And that's great to know a little bit more about what to expect as people are deciding how they need to spend their time and get the information they need. We do have a question here as well. Is there a difference if your child has special needs and is in a private school? Do the rules differ between public and private, and are the rights of the child the same?
So there is a difference, and non-public schools should have a non-public school plan, and the rights and protections of the student are different. Students with disabilities who attend a non-public school do not have the same protections as students who attend public school. So I would again encourage families to look on the Michigan Alliance for Families website, and we have a lot of information about non-public school plans and private schools and charter schools and the difference between all of those in what the rules are and regulations and what services can be provided and all of that information.
That's great. That's awesome that that's out there too. Well, we are going to be wrapping up the questions here, but I just have one more question. I just wanted to know if there's, one takeaway or something that you feel like is kind of the most important thing, either the first step to take or the most important thing when thinking about the situation. I know there's a lot of different variables here, but can you give some of your opinions on, what you think is most important for parents to know?
So from my time doing advocacy and providing support to families, I would say that the main thing that I think is the most important, as my opinion, is to keep communication open and ongoing. I think that's where a lot of things break down between teams, between families and schools, is, everybody is working for the benefit of the child and wants the child's needs to be met, but sometimes it's you're thinking about what your child needs, but how you're looking at it might be a little different from a parent's perspective or a school's perspective, and where it breaks down is when the communication stops. So keep communication open and ongoing, and document conversations and address questions quickly, especially now. Don't wait and let things linger. If you have concerns as a parent, address those, bring them up immediately and try and get resolution to those.
That's great. We actually do have one more question that came in that I want to make sure that we get to just real quick. It said, for students who live in one county but are enrolled in another county, who's responsible for providing services?
It's the county that they are going to school in. So there's a resident district and an operating district, and the operating district is the district that's responsible for providing services.
Great. All right. Well, thank you so much. We appreciate everybody's questions and obviously your time as well. I'm going to turn it back over to Dr. Hudson.
Thank you, Audrey, and thank you so much, Michelle Driscoll. This was extremely informative, and I know as people are still thinking of questions, you may have heard something, you weren't able to type your question fast enough, and I just wanted to make sure that everyone had the telephone number to get in touch with Michelle. It's 1-800-552-4821. This is actually the entire Michigan Alliance for Families phone number. The website is also www.michiganallianceforfamilies.org. So thank you so much again for that information. I will definitely be sharing this with my staff. I also have a number of friends who have been asking, Darian, what do I do? My child's on an IEP. I want to make sure that I'm meeting his or her needs. Where do I go for help? So I will definitely be referring people to this. So this was extremely helpful, Michelle. I can't thank you enough. But for those of you that might be listening and you also still need help in other ways, our 211 call center is open 24 hours a day, 7 days a week. And so if you're experiencing a need of any type, you can call 211. Just have to remember those 3 digits. We have a running list of available services that are available to you in the community and can connect you to the supports that you need. This includes food pantries, diapers, utility assistance, anything that you can really think of. You can call 211 and we will have those resources available for you. It will connect you to 1,300 nonprofits and social service agencies in our region. You can also look up these resources in your area by going to our website. It's www.unitedwaysem.org/211. And on the search page, you can enter the resources that you're looking for, and it will give you an available list of those supports by zip code. So today's town hall is just one installment of a series of town halls we're providing to connect you with the information and the resources that you need. We're asking that you join us next week for our town hall. We are very excited that we have the Lieutenant Governor Garland Gilchrist with us to discuss the Michigan Coronavirus Task Force on Racial Disparities and the progress that they've been making and what we can expect to see in our communities. To see our previous town halls, please visit unitedwaysem.org/virtual town halls. The website is also included in our chat box. As a result of this pandemic, we know that families and individuals throughout our region are struggling to make ends meet. That's why we are asking Congress to continue to provide supports for our families in the next COVID-19 relief package. Please join us by visiting standwithunitedway.org. And lastly, and most importantly, please do not forget to complete your census by September 30th. Today is September 9th. We have 3 weeks left. It's only 9 questions, and it takes a few minutes to do this. When I say a few, I mean somewhere between 10 and 15. The census impacts funding for so many important programs and services, many that we all count on to meet our basic needs, like our schools and some of the services that we heard today from Michelle Driscoll. So please, please make sure that you are counted. Thank you, everyone. Stay safe, be healthy, and continue to live united.